In one of the most populous cities in Canada, a troubling crisis continues to grow: child poverty. According to the latest 2023 report from Social Planning Toronto, over 1 in 4 children in Toronto now live in poverty, a sharp rise from 2020. The report highlights how poverty disproportionately impacts Indigenous, racialized, newcomer, and immigrant children, revealing deep-rooted inequalities that shape not only futures but health outcomes for the very beginning of life. Behind the statistics are children struggling with limited access to nutritious food, stable housing, healthcare, and emotional support, all of which directly influence their physical and mental well-being. Dr. Abhishek Raut, medical director at Appletree Medical Group, joined us to unpack how poverty affects the health and well-being of children in Canada and what the long-term developmental consequences are for children who grew up in these conditions.
Well, child poverty really has quite profound and far-reaching effects on the health and well-being of children in Canada, beginning even before birth and then continuing throughout their lives. So even prenatally, poverty-related factors like maternal malnutrition, inadequate prenatal care, high-stress environments can all lead to poorer birth outcomes, such as low birth weight and increased risk of complications. During infancy and early childhood, poverty contributes to a lot of conditions like food insecurity, playing a huge role in nutritious meals that the children can have. Certainly, poor housing conditions can play a role as well for respiratory illness, asthma, and developmental delays. So as children grow, these effects will persist. Poverty is associated with a lower access to healthcare, meaning as you are perhaps sicker, you are actually also getting less access to healthcare at the same time. So what we see is delayed diagnoses for many chronic conditions. And certainly we start seeing educational barriers emerge as well, such as poor early childhood education and also academic struggles. I think we see a lot of long-term consequences here. I think there are huge impacts that we see, and it contributes almost to a cycle of poverty and health inequity there. Poverty contributes significantly to a lot of mental health stressors that we see, chronic stress and toxic stress. So children in poverty almost always will experience a chronic stress, which can result from the unstable housing and the food insecurity and financial strain. There's also a toxic stress that we talk about, which is really a prolonged exposure to hardship, which disrupts the brain development and affects a lot of emotional regulation, and also increases the risk for anxiety disorders as well. Overall, we do see a higher risk of chronic illnesses. Children in poverty are more likely to develop asthma, obesity, diabetes, and cardiovascular disease because of poor nutrition. And although these conditions do cause a lot of harm in early childhood, they also certainly cause a lot of harm later on as well. And then finally, we do see issues with weakened immune systems. So chronic malnutrition and chronic food insecurity will contribute to just a higher rate of infections and slower recovery from illnesses, not just in childhood, but also in adulthood and also as we get much older.
Toronto's child poverty rate surged from 16.8% in 2020 to 25.3% in 2022. With these statistics in mind, Dr. Raut discussed what the immediate health implications of this significant increase are.
So that was an incredibly sharp rise in poverty. So going from 16.8 to 25.3 essentially it makes Toronto now the child poverty capital of Canada. So there's significant and immediate health implications for it. The immediate ones are, of course, increased food insecurity. So we're facing basically 1 in 4 children having struggled access to nutritious food, causing malnutrition, developmental delays, and then we see an increase in obesity as well. A higher risk of chronic illness, like we suggested before, with respiratory illness, asthma, and diabetes. We're seeing significant mental health struggles. This is something we've seen post-pandemic in general, but especially amongst people undergoing poverty as well. We see quite strong educational barriers. So poverty really limits our access to strong early childhood education. And that means extracurricular activities, that means stable learning environments, all of which are affecting cognitive development and increasing the likelihood of academic struggles later on in life as well.
Dr. Raut mentioned that children in poverty are more likely to experience mental health issues. So I asked him to elaborate on how economic hardship translates into conditions like anxiety and depression among children. Here's what he had to say.
I think the big concern here is also a very limited access to mental health support that we have. So certainly now, 1 in 5 children in Canada has a diagnosed mental health condition. But if we look at what you can do with that mental health condition, it's very difficult to have access to affordable therapy and counseling, and that's for the most of us. So imagine if we are dealing with people who have poverty. So low-income families are going to face often much longer wait times for mental health services, which is leading to untreated depression and anxiety. Children in poverty may also struggle with bullying, low self-esteem, and social exclusion. We see this quite often as well. And we see that now in Canada, 1 in 4 children has difficulty making friends. Making friends is actually expensive. And so further exacerbating these mental health challenges for people already at risk.